But I'm going to go ahead and start the presentation. My name is Amy Ollerton. I teach here in the nursing program, and I'm excited that you all came to hopefully learn a little bit and have some fun too. I will tell you that it's interspersed throughout the presentation. I do have some slides that say hillbilly clicker on them, because I am not a technologically advanced person. I'm very challenged at that. And when Steve Johnson, when I first got hired, he's like, oh, you got to use these, they're awesome. And so he showed me these clickers, and it took me a really, really long time to make a presentation with them. And so I decided that I was not going to use them because it was really hard, and I created something called a hillbilly clicker. Your meeting's in the other room. Yes. So, sorry, it was just kind of noisy out there. So I created hillbilly clickers, and so when you see a slide on it, this is 1, this is 2, this is 3, this is 4, and this is 5. So you're just going to show me. We don't raise our hand because then that helps other people cheat, all right? So we keep it secret on what your answer is going to be. So when you see that, please respond accordingly. All right, so we're going to do AEDs, hands-only CPR, and then just go over a few little emergencies that you may or may not see on campus, and hopefully you take from this at least one thing. So without any further ado, let's go ahead and we'll talk about hands-only CPR. If you come across somebody who is unresponsive, the first thing that you want to do is you want to tap and shout. So you're, hey, are you okay? If you don't get any response, then you're going to call out for help. That doesn't mean pick up your phone and call 911. It just means to say, hey, somebody help me. And then you're going to look at them. You want to look for about 5 to 10 seconds in this situation. Closely look at their chest. Do you see their chest moving as if they're breathing normally? If you don't see normal respirations, or if you see agonal gasping, we don't go and then hold our breath for a really long time normally. Okay, so if they don't respond to you and you don't see adequate breathing, then you're going to ask somebody to get the AED. Now, we have AEDs all over on campus, and we're going to learn about those in just a minute. But what you're going to do first is you're going to start to compress on them. We don't teach bystanders or laymen that are not medically trained to check for a pulse, because usually when you're in this situation, you're going to be a little nervous, right? Your adrenaline's going to kick in, and you're going to go, oh, they have a pulse, and it's really fast. Whose is it? It's your pulse, exactly. So we're like, if they look dead and they're not breathing, treat them like they're dead. Okay, so what you're going to do, and I want everybody to do this, so you're going to take the mannequin in front of you. If you'll stand with me, you're going to take the heel of your hand, and you're going to put it in the lower half of the breastbone, so just in the lower part of the chest, right here. You're going to make a straight line, and this is kind of hard, but it's good because most people don't die on tables. You would probably be doing this kneeling over them, so you might have to stand on your tippy toes a little bit to get straight up, and then you want a direct line from your shoulder to your wrist. So you want to be over them. You don't use the weight of your arms to push, you use the weight of your body to push down. And you want to push hard and fast at a rate of 100. There's lots of songs that you can choose for this, but we're going to go with Row, Row, Row Your Boat. It's a happy one. It takes you back to your childhood. Everybody knows it, and it's the perfect speed for CPR. Okay, and so we're going to do, that will get you a compression rate of about 100, and you want to push hard and fast. You're going to push down at least 2 to 2.5 inches. When you push, you will feel ribs crack, break, something like that. Keep going. Ribs heal, dead brains don't. And if we don't get oxygen to the brain, then we have an issue. So let's just practice that. I'll even sing for you, okay? If you want to join in, go ahead. Here's our pitch. Row, 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 row your boat gently down the stream. Merrily, 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 life is but a dream. Keep going. Row, row, row your boat gently down the stream. Merrily, 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 life is but a dream. Okay, great job. Everybody sit down. That was awesome. Yes?
How realistic does this feel to a real person?
Pretty realistic, yes. Having done it on these a lot and having done them on humans as well. It really does feel about the same. The only thing, these click, human bodies don't, but human bodies will snap, crackle, and pop as you break bones. Or even just separate cartilage. So don't let that deter you, because there's been many times that I've been pushing on somebody's chest and been like, ooh, okay, we popped another one. But you just keep going, because you just have to keep telling yourself, dead brains don't heal. That's the only thing that won't heal is a dead brain. Yes?
These are all guys.
Yes.
Where does your hand go if this was a woman?
That's why you use the breastbone. You don't, we used to say the nipple line, but that can be very different. If you need to move breast tissue, yes. You make sure, everybody, like a touchy-feely teacher to myself, and I ask you to demonstrate on yourselves as well, but I want you to feel your breastbones. You all can feel the center of your chest, okay? So you would just put the heel of your hand in the center right there. If you have to shift flesh, you shift flesh.
But in the center, I don't like.
The lower half in the center, which is, you know, we used to say between the nipples, but those are, no, it's not. So the center of the lower half of the breastbone, which is in the center of the chest. Any other questions?
I didn't hear clicking, but
It's okay. Yeah, it's okay if you don't hear clicking because dead bodies don't click either. So some of the mannequins have been pushed on. These mannequins are old and some of them don't click anymore.
hardness, does that mean you're pushing?
Yes, yes. And if in doubt, push a little harder. Yes.
It's not actually in this area here, it's right in the middle here.
Correct.
Okay.
Yeah, you want to be on bone.
Okay,
You need to be on bone. Your heart sits between the spine and the sternum, and so when I push down and squeeze, release, what is that? That's what we do all the time with our heart, right? Squeeze, release, squeeze, release, squeeze, release. That's what you're doing, and that will send oxygen-carrying blood to the vital organs. Okay?
How long should we do that?
You do it until the AED comes, okay, or until help arrives. You should, when you call for help, that means somebody help, you're going to tell them as you're rowing your boat, call 911, get the AED. Okay? If you're completely by yourself and nobody responds to your calls for help, you would pick up your cell phone and you would, or even leave the victim, call 911, and then come back and resume. Because if you're not pushing on their chest, you're not circulating oxygen. Okay? When the AED comes, because the AED will have a barrier device in it, then you can do 2 breaths to 30 compressions, but I'm not even going to worry about teaching you that because the AED tells you how to do it. These are awesome machines. They're literally dummy-proof, okay? You can't mess them up, okay? So let's go on to our next thing, which is the automated external defibrillator. I'm going to switch gears here, and you're going to watch a little video for me, okay? Just a little bit of one.
In this video, I'm going to demonstrate how to use an automated external defibrillator. In previous video clips, you've heard me mention an AED, or automated external defibrillator. Now I'm going to show you how to use one. These are wonderful machines which have made a huge difference in the recovery of cardiac arrest victims. Don't be nervous, it's really very easy to use. Research shows that more than 95% of cardiac arrest victims die before reaching the hospital. A victim's chances of survival are reduced by 7 to 10% with every minute that passes without CPR and defibrillation. Few attempts at resuscitation succeed after 10 minutes. Nearly 60% of all cardiac arrests are witnessed, so if an AED is nearby, there's a better chance for survival if timely defibrillation occurs. In cities where defibrillation is provided within 5 to 7 minutes, the survival rate from sudden cardiac arrest is as high as 30 to 45%. Other examples show survival rates as high as 86% in some cases. Step 1. Turn the AED on. Next, take the lid off. Pads, scissors, eraser, and gloves will be tucked inside the lid. The AED will then audibly prompt the rescuer.
Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyze it. Shock advised. Press flashing shock button. Shock delivered. Start CPR.
So just listen and follow directions. The pads have a diagram on them indicating where to place them. But before you can do that, you will notice that scissors are provided to cut the victim's shirt off. If your AED doesn't have scissors, tear the buttons off the shirt. If the victim has a hairy chest, use the razor supplied with your AED to shave the area where the patch is to be applied. And if the victim is wet, use clothing or a towel to dry his or her chest. It's not necessary to be totally dry though. If the AED advises you that shock is advised, it's important not to touch the victim during the shock. It will loudly say,
Shock advised. Don't touch patient. Press flashing shock button.
Then push the red heart or electric bolt button once. The AED will prompt you by saying, rhythm restored, or
Shock delivered. Start CPR.
After every 5 cycles, or about every 2 minutes, allow the AED to analyze the rhythm and continue CPR until the emergency medical team arrives.
Okay, so that is, let me come back to here, is essentially the special information that you need to know about an AED. Now, these are in every main building on campus, and they come in a black cover. I took the cover off just so that I could open it up for you easily. These are so easy to work. You have to remember 2 things, okay? First of all, unresponsive, no breathing, call for help, send someone, start compressions, and then you have to turn on the machine and follow the prompts.
Unit, okay. Adult pad.
Okay, it says here that adult pads are on
Stay
here.
calm.
Be
Check
calm.
responsiveness. Call for help.
Did it already.
Attach defib pads to patient's bare chest.
Okay. Ours are a single unit pad, and so it comes out. I'll even show it to you. So you would just, well, actually I don't want to.
Attach defib pads to patient's bare chest.
Okay, I'm going to turn that off because it will keep telling me to do that until I get it done. You would tear this open, but when I tear it open, it's going to make the pads not, the foil will dry out. So I'll show you on these right here. That's why I have my trainer, which is basically the same thing, except for it's just all of them the same concept. Turn it on, follow the prompts.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Okay, so here, there's pictures, and you have to get in bed with the poor victim and say, this picture matches here on him, this picture matches here on him. I lied, there we go. I told you they were dummy proof, right? Okay, and then I plug it in.
Analyzing heart rhythm. Do not touch the patient.
If I touch them, it's going to pick up my electrical activity. So it's important that I say clear.
Charging.
Okay, it recognized that there's
Stay
something
clear
wrong with his
of
heart
patient.
and he needs defibrillation.
Deliver shock
So
now.
it's charged.
Press the orange button now.
I'm going to make sure everybody's clear. I'm not touching the table that he's on or anything. Clear.
Shock delivered. Paused.
Okay, it gives you a second to
Begin
regroup.
CPR.
It says begin CPR. That's it. Some of the AEDs will prompt you even further on the CPR and say place hands in center of chest. Push down, and then it says, and then it gives you this little boing, 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 boing sound that you push to. Or you can sing row, row, row your boat. It's okay. We won't think you're crazy if you're singing.
Start CPR because the charge didn't work.
No. What it does is you shock, and then you immediately go back to doing compressions until you know that they have return of spontaneous circulation, which they would start to breathe. So if you don't see breathing, and because these are automated and they're for lay people to use. So when you've called 911, when the rescuer people get there that have the manual defibrillators, they would put them on their monitor and they would say, oh, there's an organized rhythm. You're not going to hurt them by pushing on their chest. You will hurt them if you don't push on their chest and they need it. So you always start, as soon as a shock is delivered, always do chest compressions again. Okay? Yes?
Sorry.
I'm looking at Laura and then you. Okay.
We are never personally determining whether their heart is beating or not.
Absolutely not.
We are only determining whether they are breathing.
Correct.
Okay.
Correct.
And so,
Absent breathing is going to equal absent heart. 99.9% of the time, which is why they've done decades of studies and they found that they had well oxygenated dead people because we were breathing for them when we didn't need to. They needed chest compressions. Okay?
so like on that, once it tells you to go back to CPR, do you ever go back to the
In 2 minutes, you're doing compressions for 2 minutes and it will say analyzing, don't touch. It automatically recycles through.
And so it's okay to put it back on there and do
Oh, it stays on.
Oh,
It stays on. Yeah, it stays on. And ours even has a little blue thing that says this is where you push on. So that you lay it on the chest, it's going to have the pads where they need to be, and here's where you're going to push to do your CPR. They have this little baggie right here, has the barrier device and a shaver.
I was going to say, I mean,
Because you do need,
it take a while to get to a very
right,
I mean, there's plenty of garments on people. They
right.
have to be going-
And that's why we have scissors, and you just cut. You cut straight up, and you remove bras, whatever, because you need to be you need to have bare skin to do the AED. Okay? Awesome. Yes?
If you don't hear what he says right away, is there a little repeat button? How would you get him to?
Oh, it's loud.
No, like just listening to it, I didn't catch it
It was
right
a little
away.
fuzzy, like if it's, if
Oh,
And
you
if
didn't
you're
understand.
yeah. Oh, okay. If you don't do what it tells you to do, it repeats it.
right away,
Yes.
you don't have to wait. Okay.
No. It's like, come on, let's do it.
Get it to repeat. Like,
No, there's not a repeat button. But if you don't do what it's telling you to do, it repeats, this is what you need to be doing. Okay? Yeah, they're fantastic machines. Any other questions on the AED?
Is there one of those in the stadium?
There should be. I would say yes. Or the trainers are going to have them.
Well, the reason I ask, I have Band-Aid, Saturday. There usually isn't a trainer.
Okay. Usually, that would be a good question to ask administration, but I know that they put them in every main area of campus. So that leads us to our first hillbilly clicker question. I personally know where the AED is in the building that I work in. 1 is true, 2 is false, 3 is I work. Okay, so just think about that for a minute. And if you don't know where it is, that's your mission after this, is to go and find out where it's at, so that you can grab it when somebody, because I personally would rather go get the AED than do chest. No, I'm just kidding. I'd be like, you're doing a fine job. I'm going to go get the AED. Another thing is as soon as more people get there to help, you don't want to do chest compressions for more than 2 minutes. So when it says to analyze again, which it will do every 2 minutes, trade and have somebody else come in and do chest compressions. You'll be fatigued and you will lose your efficacy in the depth that you compress. Okay? I'm going to put my lights low again so I think you guys can see a little bit better. Okay, so we're going to move on to choking. Choking can be an emergency because you're going to have the inability to speak if that happens. Oftentimes, adults and children will grasp their throat when they're choking and make the universal sign for choking, like Bart is doing here, with a little help. Okay, so what you're going to do is you're going to stand behind your victim. This is your victim. So you're going to hold them up, and you're going to stand behind them. You thought I was just going to come and sit. No, not today. Okay. You're going to put your finger, as you come around their chest, you're going to put your finger in their belly button. And then you're going to take your other hand and you're going to make a fist. Okay, what you're feeling up here is the xiphoid process, and that's the top of the bottom of the sternum where we push for chest compressions. It's down here at the bottom of your half a man. A little bit further. There you go. Feel that little knot, that little nubbins. Okay, so it's touchy-feely time. We go into the belly button. We take our other hand and we go just directly above the belly button. And then we cross over like this, and then it's really technical, okay? You're going to scoop up their guts, and you're going to squish them into their diaphragm, which will create in them a cough, a coughing mechanism. So you scoop and squish. Instead of being able to cough from their throat, they're going to cough from below their diaphragm. Scoop and squish until they pop the object out or they drop. Okay, so as many times as you need to. If you cannot get your arms around somebody's abdomen, they're expecting, we don't use fetuses as a ramming device, okay? Or if they're just really rotund and you can't get your arms around them, you can go in their chest and do it. It may not be as effective, but it's better than nothing. Okay, so scoop and squish until they pop or drop. When they drop, or if they drop, call 911 and start CPR. Okay, and if you're going to do a breath, now I will tell you that I've been a health care professional for too long. I will be very selective in who I actually do mouth-to-mouth on. Okay, I'm sorry, I don't know that I could do it. I have to have a barrier device. And that is what is recommended, is a barrier device. If it were my husband, maybe I'll think about it. Children, probably. Grandkids, yes. I'm just kidding. So what I would do is I would tilt back the head, and if I'm going to give a breath, as I open their mouth, if I see an object, I would do a finger sweep and give it out. Get it out. If I don't see the object, then I'm just going to try and give some breaths. And so you would give 2 breaths, and then you would start again. Any questions on choking?
Pinch their mouth still?
Pinch their nose, yes.
Oh, that's nice.
Yeah. Yeah, so you would tilt their head, pinch their nostrils, and cover your mouth with their mouth and give a breath. When you put the barrier device down, which is just kind of a little sheet in here, you put the sheet on and you do it the same way. So you would tilt the head, pinch the nose, blow, blow. So.
How long do we do that? Or
2 times.
just twice?
Yeah.
And then go back?
When 30 compressions, 2 breaths. Okay, when you're trying to dislodge, or after you've done your 2 minutes of hands-only CPR, you can go to 30 to 2, where you do 30 compressions and give 2 breaths. Okay, but for this class, I really abbreviated it down, because really what they need is 911, AED, and chest compressions. So breathing is bonus. Standing here right now, and you sitting there right now, we have an 8-minute oxygen reserve in our body. So all of the cells, all the oxygen in our cells, but we need to get it to our vital organs. And so by simply compressing that, and the body is really smart, and it figures out something's not quite right here. And so it pulls the oxygen away from fingers and toes that is not necessary, brings it into the core, and it'll circulate to the core organs. I know, it's amazing how smart we are without knowing. Okay, sometimes life just happens. That was about 30 seconds, right?
Free medical rescue and advice with all contracts.
But she still gets insult to injury.
Chelsea, for yourself.
So in 30 seconds, that poor girl had a head injury, she had a fall, she had a dog bite, she had an electrocution, she had a burn, she had a cut, she had a near drowning, she got a foreign object in her eye, and then was beat to death by a helicopter. So you just never know when life is going to happen to you or to somebody around you, and so it's always best to be prepared. So we're just going to talk about some of the things that you might experience here on campus or in your own homes. Fainting. Now, how low do they go? First of all, typically people who faint are standing. They can be sitting, but usually they're standing. And what happens is if you put your hands on your hips, absolutely nothing is vital in your body from your hips down. Okay, we can live without it. So all of our vital organs are here, and they have to fight gravity. And when we stand in the heat, or if our blood pressure gets too low for whatever reason, all of the blood that's in that half of our body, our brain says, we need more oxygen. And our body says, well, we'll try and fix that so you pass out, so that we no longer have to fight gravity to get blood, oxygenated blood to our brain. So it's a simple safety mechanism. So first of all, don't panic. assist them to the ground, and then clear the area. You want to loosen tight clothing. You don't want to impede any circulation. So if they have on tight jeans, go ahead and unzip the band. I know that that kind of gives people some pause, but you're in an emergency situation. If they have a shirt on with a necktie, loosen the necktie. Okay, I'm not saying strip anybody, but just loosen those constrictive bands that they might have in their clothing. Bathe their face with cool water and slightly prop the victim's legs. Okay, one of the things that happens is, again, half of my blood supply is not in a vital area. And so I want to create just a slight siphon. So if I just raise those legs about 6 to 12 inches off the ground, we used to like crank them up, and we discovered through evidence-based practice that that actually impedes their breathing and stuff because it pushes their abdominal organs up against their diaphragm. So we're like, don't really go crazy, but just raise them 6 to 12 inches. That will help blood flow get back to the vital organs and to the brain where the brain wants it. Once they come to, you don't know what the cause was, and sometimes it can be a low blood sugar. And so as soon as they are awake and seated, sitting up and responsive to you, offer them something sweet or sugary to drink when they are revived, but make sure they're revived. Okay, here's some of the don'ts of fainting. Don't vigorously shake them. Okay, shaken baby syndrome can happen in an adult as well. Don't try to revive them by slapping. It might make you feel better, but it really does not help the situation. Okay, they're not going to come to from slapping. They need to come to with oxygen perfusion to their brain. Don't throw water on their face. See it in the movies all the time. Again, not helpful. And one of the things that happens is when somebody goes unconscious is their body says, we're going to protect your airway, and you're going to breathe, and you're not going to swallow. And so if you throw some water into their face or put anything into their mouth, thinking, oh, she said to give them something sugary in case it's low blood sugar, but if you put that into their mouth, they will aspirate that. They will breathe it into their lungs because the gag reflex and the swallowing mechanism goes away. It's a protective mechanism so that the airway stays open. And the body says, you're unconscious, you're not eating or drinking. And we're going to keep the airway open. And so the epiglottis won't close. And so you can cause an aspirate by putting anything in their mouth or throwing water in their face and having them breathe that in. So those are the don'ts with fainting. Any questions on that? And it can take sometimes several minutes for them to revive. As long as they're breathing, you're okay. Okay? As long as they're breathing, you're okay and they're okay. Yes?
In the movies, they always
The ammonia inhalants, yeah. Those, sometimes we carry those on our, because I work in OB and women like to pass out after they have their babies and we try to get them up. So we do have those, and I will say that if somebody's completely out, it doesn't help. When they are going, oh, I feel, because sometimes it's a little drama, and we put that noxious in, they're like, whoa, we're like, oh, okay, you're feeling much better now, aren't you? Let's stand up and go. So that's kind of what I use them for. It's not really to bring them to. It won't wake them up, okay? All right, so here's our hillbilly clicker. Simple fainting often leads to the cessation of breathing. 1 or 2, true or false? Okay, that is false, okay? Simple fainting is what we just described, where they feel woozy, they feel lightheaded, and they pass out for whatever reason. They're going to be breathing. Okay, when somebody has a heart attack or a massive stroke that's going to stop their breathing, it's instantaneous. And they usually, they slump over, and then you go to assess them, and there is no breathing. And that's when you would start chest compression. So there's a difference between the two. All right, for our seizures, our do's and don'ts for seizures. There are several people on campus that have seizure disorders. And also, somebody else that is at high risk for seizure disorders are diabetics. If their blood sugar gets too low, the brain throws a temper tantrum by having them have a seizure. And so these are the most common reasons would be epilepsy or a low blood sugar for having a seizure. So if somebody starts to have a seizure, clear the area. If they have epilepsy, there are certain things that may happen before. You'll see them in class, and as the lungs start to seize up because they're going to have a seizure, it forces the air that's in their lungs out through the trachea, and so they often make a high-pitched cry sound. Oh! all of a sudden, and then they start to seize. And that's normal. That's just the body's way. And I kind of liken, like a seizure activity in the brain is kind of like that gerbil wheel, and that gerbil gets in and starts spinning. And instead of the seizure, the brain sending out those nice signals back and forth like it needs to, it starts to cycle around. And so it tells the body, stop, go, stop, go, stop, go, stop, go. And so that's what they do. So they stiffen up, and then they start to jerk. And it's normal. It's terrifying to see, but it's normal. The things that you want to do is you want to protect their head. I have a brother-in-law that has a seizure disorder, and when he was about 15 or 16, he had an unwitnessed seizure in the bedroom, and he fell on the floor, and he got a horrific rug burn all on his face from banging his head against the carpet. Okay? You will see them, they'll seize up their jaw. I know people that have epilepsy that are missing teeth because people tried to put things in their mouth thinking that they were swallowing their tongue. And that's not physiologically possible, even in a seizure, okay? Because their lungs and their chest wall gets very rigid, they won't breathe adequately during a seizure. So when the seizure lets go of their body, when that brain activity lets go of their body and they relax, oftentimes flecks of foam come out of their mouth, and they will take these big, shuddery breaths. That's just their body's way of compensating for what happened over the past 90 seconds. So those are all normal pathways of seizure recovery. So sometimes, one time my brother-in-law had another seizure, and he caught the inside of his cheek, because the jaw clenches up in between his teeth. And so, yeah, it looked like hamburger, okay, blood coming out, everything like that. You can't open their jaw. You can fracture their jaw trying to open their mouth, thinking that you're protecting their airway. Their airway is protected. It's just seized up, and it will let go, okay? So you protect their head, because you don't want it banging onto the cement or something like that. But you don't restrain it. So you just take a jacket or even your hands and put them underneath so that they'll kind of bang on your hands, but you're allowing free movement during a seizure. Push away any things that might hurt them. If they're sitting at a table and they fall over, make sure that the table is pushed aside or the chairs are pushed aside so that they don't repetitively bang into a hard surface. Do roll them onto their side. Okay, so go ahead and roll them onto their side. Try to discover the cause. Look for a medical alert bracelet or a necklace that says that they have a seizure disorder, or ask somebody, maybe their friends, has this ever happened to them before? Do they have diabetes? So try and discover the cause. Monitor the time. If a seizure goes for longer than 5 minutes, then you would be wanting to call 911. And in all honesty, my threshold would be about 3 minutes, because I know it's going to take them a couple minutes to get there. If they come out of the seizure, fine. That you're on the phone with 911, you'll be like, okay, they stopped seizing. But if it lasts longer than 5 minutes, now they're getting into the point where they can have anoxia to their brain. They can have a lack of oxygen to their brain if it goes longer than 5 minutes. And so you would want to get get somebody there that can help halt the seizures medically with medications, and then restore oxygen to them with a mask. And then so you would want to call 911 if it's lasting longer than 5 minutes. That's the standard, and that's what it is in the books, but I'm going to tell you my threshold is probably about 3. 3 minutes is a really long time when somebody is seizing. 90 seconds is a really long time. Okay, so don't panic. Don't try to restrain them in any way. We talked about a little bit about that. Don't try to force objects in their mouth. We used to have bite blocks that we would use, and we don't use those anymore. And don't attempt to move them from one location to another. Their muscles are going to jerk regardless of whether you hold them down, and you can tear tendons and muscles. You can cause tendon tears and muscle tears by trying to restrain somebody who's seizing. So just let their body do what it needs to do. Does anybody have a question about seizures? Okay. I would also, if I were here on campus, I would clear the area, because it can be embarrassing to them when they come to. So just, be sensitive to that as well. Just say, could everybody just step outside the room?
There was a woman, this has been many years ago, but I guess she was having seizures, and we got the word people were calling 911, and
She's like, I can't afford the ambulance ride.
And so keep telling us don't call right away.
Right, wait those few minutes, exactly. Because it is something that, you know, they're typically on medications, but it takes months to regulate the medications. And they get charged for every ambulance ride that they take. So, yes, it is very expensive. All right, wound care. Cuts, abrasions, fall outside, skateboards, bikes. We have all kinds of, you know, opportunities for wounds to happen here at school. First thing that you want to do is control bleeding, and I'm going to grab the quickest and the cleanest thing that I have. Now, if I grab this right here, this is quick. Would you want me to put this on your wound? Yeah, probably not, right? So it might not be, it might be the quickest, but it's not the cleanest. Upstairs, I have lots of stuff. I have dressings and I have things that are in sterile packaging. But if you were in the math science building, that might not be the quickest. Okay, so find a happy compromise to take and put on that wound. So you put quickest and clean on them. And then you apply direct pressure. If it starts to come, if blood starts to come through your fingers, then add more. Don't take away. Your body, as soon as it gets cut, your body goes into defensive mechanism mode and it will start to form a clot. So if you take away, or even if you peek, don't even peek, okay? If you take away while it still is actively bleeding, more than likely you'll pull the clot with it. And the body's like, thank you, I was 6 minutes into forming that clot and now I'm gonna start over again. So keep it covered and add to it if you need to. If you're even more concerned, you can get an ACE wrap and you can wrap it around it to hold a compression bandage on there. But don't stress so much about blood. We tend to really panic about blood when we see it. So I'm just going to give you a scenario. If somebody walked into the room right now and they had their hair matted with blood dripping down their face, and half of their shirt was sticking to them with blood, would you feel like that was a reason to panic? Would that make you a little bit nervous? Okay. That is about, it takes about 1/4 cup of blood to do what I just described, to saturate the hair, stream down the face, and soak half of a shirt. 1/4 to 1/3 of a cup, okay? Based on how thick your hair is, I guess. You can safely lose a pint in just a couple of minutes because American Red Cross rewards you with juice and cookies when you do, right? It's perfectly fine. So don't panic when you see that because they have plenty to spare. So just kind of don't panic. So, and then once you get your bleeding controlled, you want to cleanse the area with soap and water. Our skin is our barrier for bacteria, and bacteria is everywhere and it lives there, and it wants to be inside. The party is way more fun inside, so the skin is the bouncer. We need that skin to be intact. When it's not, we have an opportunity for infection to take place, so we need to cleanse it. And so we want to cleanse it soon after the injury occurs with soap and water. And when you cleanse a wound, you want to use running water because the pounds per square inch that comes out of a faucet is about 5 to 8 psi. And that's the perfect volume and strength for debriding a wound, for kind of causing some turbulence in it to get rid of the little particles and stuff. And so you cleanse the wound with that. After that, it may bleed a little bit more, so you might have to add pressure for just a minute or so, and then go ahead and dress it with antibiotic cream and a Band-Aid. Okay? How many of you were told leave your wounds open to air? Let that scab form. Okay? Actually, a scab is a poor substitution for a bandage because our body inside, is it wet or dry? It's wet. So we want it to stay wet as the skin knits and heals together. So applying that cream and keeping it covered in a Band-Aid is actually better for you than ending up with that dry scab. So keep it covered as much as possible. Monitor closely for infection. Seek expert care if the bleeding won't stop or if it looks like it needs to be stitched. And oftentimes bleeding won't stop when it needs to be stitched. Another high-risk wound would be a very dirty wound, an animal bite or a human bite. Humans are dirtier than animals when it comes to bacteria in the mouth. Yes?
Stepping on a nail.
Stepping on a nail. Yes, absolutely. That is a dirty wound, okay? Because if you need to get that tetanus shot. And the tetanus shot needs to be administered within 72 hours of the wound. So it needs to be evaluated. When in doubt, you know, my motto is it cost me $25 copay. When in doubt, check it out. Go get it checked out.
Also a bacteria that forms inside the tennis shoe, the sole of the tennis shoe that will drop onto the bone.
Yes, and cause an osteomyelitis.
Yes.
And that's several weeks of antibiotic therapy. Yes.
With that too, where it nicked surgery.
Yeah.
He nicked it.
Mm-hmm.
He ended up really bad shape.
Yes. It's about 6 weeks, 6 weeks to 12 weeks of antibiotic therapy if you get an osteomyelitis. So puncture wounds, let's go ahead and talk about those for a little bit since you brought it up. That's the only type of wound that you actually encourage to bleed because it's deep and narrow and it's gone in and carried that bacteria in, and so encouraging it to bleed, so like literally milking it. You milk the foot, you sit there and you strip it and you get blood to come out of it so that it'll carry the impurities out is the goal of that. So, all right. Okay, so another hillbilly clicker question. Of the following, which agents are acceptable for use as a wound cleanser? Hydrogen peroxide, soap and water, rubbing alcohol, betadine, or all of the above? Some people are scared to commit. It's okay. Soap and water. That's all that's on this list. Hydrogen peroxide, OxyClean, right? Fantastic for laundry. It destroys the membrane wall of proteins. What is our body made of? Proteins. And so when you put hydrogen peroxide in a wound and you see that bubbling and stuff, you're like, oh, this is awesome. It's really doing a good job. It actually increases the size and the intensity of the wound. And a wound that you take care of with the dews that I had, if you do the dews, heals in about 7 days. An identical wound with one application of hydrogen peroxide is going to take 13 days to heal. So take it out of your medicine cabinet and put it in your laundry because it's fantastic for getting any protein stain out of laundry. Soap and water is the correct answer. Alcohol, rubbing alcohol, well, we use it all the time in nursing, but we scrub intact skin before we puncture it. Okay, so don't put it inside a wound. It's damaging to the tissue inside. Betadine, same thing. We use it to cleanse the skin, the bacteria off, and kill the bacteria off of the skin before we go into the skin. But it can be damaging to the tissue underneath. Okay, so the answer was 5. Oh, I'm sorry, was 2.
Back to when you're dressing your room of wounds, is there anything you shouldn't use? Because quite often they'll just say, don't put anything on it, let it heal.
If it's a shallow wound, antibiotic ointment is recommended because you're exposed to bacteria, and so it will just kind of help hold it at bay. So, all right, moving on to the next one. Here's our don'ts in wound. Okay, don't remove that saturated dressing. Remember that, you'll pull that clot away and start your bleeding again. If you have a wound that's like to the head that's comes from blunt trauma, you would want to take this wound and you wouldn't want to put direct pressure because you could possibly have an underlying skull fracture. And we don't want to push bits of bone into the brain or debris into the brain. Same thing with our eye. Our eye has its own ocular pressure. So if I were to put direct pressure on my eye, then that would mean that I would push against the optic nerve and I could cause damage. So what you do in this situation, I know this is not quick and clean, but I'm just going to demonstrate with this. Okay? You're going to take it and you're going to form a ring. And then you would put this around the wound and then put pressure so that you're around the edges of the wound instead of directly on it. So in those cases, you would kind of build up around it before putting the pressure so that you wouldn't run the risk of pushing that bone into the brain or injuring the optic nerve. Don't use those other cleansing agents. Soap and water is your friend. Don't keep wounds open to air. Scabs are a poor substitute for a Band-Aid or a bandage. Okay, and then don't delay expert care when you think it's needed. Wounds can cause a topical infection, which is just on the skin, but if it gets down into the bloodstream or down into the vascular system at all, you can end up with a systemic infection. When you start to have fever, when you start to have swollen glands, or because of a wound somewhere else, that is a signal that it has gone throughout your body, and it's a very high risk, and so you'll need to have oral antibiotics or even IV antibiotics to care for that wound. And the tetanus shot, 72 hours. Tetanus lives everywhere, and if it gets into our body and we're not protected from it, it is fatal. So when in doubt, if you have a tetanus booster, I'm really good at wounding myself, and so not purposely, but I just seem to do a really good job of it. Basically, every 5 years, I manage to hurt myself again so that I can get that next tetanus booster. They say they're good for 10 years, but if it's been 5 years and you have a risky wound, they're going to give you another one, another booster, just in case, because it doesn't hurt to get them too often, but it definitely hurts if they've waited too long. So the booster is good for 10 years, but they say 5 years.
What about pencil lip?
It's graphite. We used to call that lead, but it's actually graphite. But that would be a puncture wound, and so that could be a risk. Yeah. It's more the mechanism of the wound, which would be a puncture wound, than what's actually in it. Yeah, well, we probably all have. Okay, any other questions about wound care? All right, moving on. We're getting close. All right, stabilizing accident victims. First of all, scene safety is priority. If you can't go to the accident scene safely, then you should not. You stand back and you call 911. If you can get to them, keep them in the position that you find them in. Okay, so if they're like hunched over, try to keep them hunched over, or if they're conscious, I should say, if they're conscious, keep them in position. Their body will act as a natural splint. So if they have a spinal injury, like the vertebrae, they might look like they're in an unnatural position. Keep them in that unnatural position because the body actually works as a self-splint. So try not to move them. Assess their movement and sensation. And ask them if they're conscious. Did you feel an electrical current or a shock? Did you feel like you hit your funny bone anywhere? And they'll tell you if they have that, then you need to be concerned about nerves being damaged. That as they come out of the spinal cord, which is the nerve root. So you would want to be very careful with that person and let expert help come and take care of them. Do control obvious bleeding. They can, if it's a large wound, even though I told you don't panic, but they can exsanguinate, which is where they lose their blood volume through large wounds. And try to obtain victim information about, what were the events leading up to it? Do they have any allergies to medications? You might be the only person that talks to them when they're conscious. And so it's kind of nice to know those kind of questions. So their name, their age, and it also kind of distracts them. And you, just ask them some questions. Have a conversation with them. Okay, drug overdose. It's kind of sad that we have to talk about this, but it is actually more and more common in our society today. Protect the environment. Most people that are under the influence are a danger to themselves or a danger to others. And so you need to protect yourself and you need to protect the environment. There are different kinds of drugs. Uppers stimulate, amphetamines, so they accelerate behavior. Cocaine is an upper. Your amphetamines are uppers, your PCP is an upper. Downers, alcohol is actually a downer. It depresses our body. Opiates are downers, barbiturates are downers. Hallucinogenic, marijuana has hallucinogenic properties. Also your aerosols, the huffers, the people that breathe in the paint solvent and stuff like that. Those are hallucinogenics. And angel dust is also another one that is a hallucinogenic. Assess their airway breathing and circulation. Sometimes they have severe respiratory depression and they need rescue breathing and CPR, especially with heroin. Heroin is it metabolizes into morphine in your body, in the brain, and it's very potent and very fast acting. And it's one of the things that we are seeing a lot of overdoses on. Call 911 and keep the victim warm. There are some drugs out there that create a sense of euphoria and warmth, and so they don't recognize that they're cold. And because of the way that they're changing their metabolism, their heart will beat faster, and so they will lose blood flow to the periphery. And so if you move them quickly, you can cause a cold-induced heart attack. So if you come across somebody and you suspect that there's been drug use and they may or may not be unconscious, then keep them warm. Put a blanket over them. Yes?
Most of us don't have the barrier probably with this. Is there any just home remedy something real quick you could do that might?
I would say better than nothing, put a t-shirt over their face. Yeah, blow through a t-shirt. Yeah. Like I said, 25 years in the healthcare, I'm just like, oh, I don't know if I really could do that. It took me a long time to be able to change a diaper with bare hands. So, you know, bodily fluids and but that would be something you could use as a t-shirt. But just know that that's not going to fully protect you. So, and it sounds terrible, but people that chronically use drugs also have a lot of high-risk infections as well. They are tuberculosis, HIV, hepatitis C, especially if they use needles. So you have to protect yourself first. I know that sounds really harsh, but you have to protect yourself first. Okay. So here's she looks like she's on something, huh? Okay, so the most commonly used and abused drug is number 1, heroin, number 2, methamphetamines, number 3, aerosols, number 4, alcohol, and number 5, marijuana. It is alcohol, right. That's the most used and abused drug in the world, actually. Okay, so diabetic emergencies. If you have a student or a coworker that's diabetic, sometimes they exhibit bizarre behavior. Sometimes that's just their personality, but sometimes it's because they're having a diabetic emergency. They may be pale or flushed, often clammy. Their skin gets very clammy. They may have a fruity odor, almost in their sweat smells fruity, their breath smells fruity. They may be breathing deeply and rapidly or shallow, depending on whether their blood sugar is high or low. Unless you have a monitor, like is on the picture, and you can check their blood sugar, you're going to treat it, you don't know. You're going to treat it as if they have a low blood sugar, because you'll never hurt them by giving them sugar, even if they have a high blood sugar, because we can just bring it down with insulin. But if they have a low blood sugar because they have too much insulin in their body and it's not regulating, and you don't give them the sugar, then they can go comatose quickly. So it's very important when they're responsive to give them sugar, and it's the 15 for 15. You give 15 grams of sugar, which is about 4 ounces of juice, and you wait about 15 minutes, and they should respond. Now, they're not going to, you're not going to hand them juice, and they're not going to go, thank you so much for giving me that juice. I needed that. I feel so much better. How did you know I needed it? They're going to fight you. They're going to be combative. They may curse at you, and they never use that kind of language. Their brain is shutting down and is saying, I need sugar. Get it for me. And their brain, when that happens, the brain perceives everything around them as an enemy. So you become a frenemy. So when you give them the juice, oftentimes it takes a lot of encouragement to get them to take that juice down. So, and make sure they're conscious as well. So give them the juice, wait 15 minutes. If you don't see significant improvement, go ahead and repeat that dose of juice, but consider calling 911 at this point, especially if you don't have a device to monitor their sugar levels in their blood, so that you can get them the help that they need. Because they may need insulin, or they may need an insulin drip, or they may be profoundly hypoglycemic and need IV sugar to get them regulated. So call if there's no improvement. Okay, so another hillbilly clicker question is, a diabetic in crisis often will exhibit behavior similar to someone that's under the influence. That is true. Yes, absolutely. Anaphylaxis is an overwhelming allergic reaction to something. When somebody is anaphylactic, their body overreacts to a foreign protein coming into it. And the body has set up a defense system, a really well-orchestrated army in there to say, I don't care if we kill the host, we're going to win this war. And so when the foreign protein comes in, this cascade happens, and it sends all these soldiers out, and it says, if it came in through the lungs, we're going to shut it down. You're not going to breathe. We're going to cause extreme swelling. You're going to get itching and hives blowing all over your body. Your heart is going to try epinephrine. Your body's going to try and create some epinephrine to increase your heart rate, and the body's going to go, that army's going to go, oh no, we're not circulating any epinephrine. And so they can't keep themselves alive in this battle. And so you have to help them. So you call 911. If they have an epinephrine pen, you administer that EpiPen to them. So you give the epinephrine pen. You don't need to expose their skin or anything like that. You just put it up against their thigh and you click it. And you have to hold it there and count 1 Mississippi, 2 Mississippi, count to 10, because it's going to auto-inject. If you put it up to their thigh and click and then pull it away, the epinephrine is going to drip out onto the floor. You need to put it, so you need to make sure that it all administers, so you count to 10 while you're administering it. Another thing that you can give them, the body, one of the things that it does is the mast cells that hold these soldiers in, and soldiers are called histamine. And so it'll flood the body with histamines. And that's what causes the wheezing and everything to happen, and the hives. So if you have liquid Benadryl, you can give it to them, but tell them to hold it in their mouth. You don't want to give them a tablet or a caplet, because they'll swallow that, and that goes into their digestive system, and it will take 45 minutes to an hour to even become beneficial to them. But they make these little Benadryl tabs that they can carry, and they just put it on their tongue, and it dissolves directly into their bloodstream, or they hold it in their mouth, and it will dissolve and absorb into their bloodstream, which will then effectively get it to them almost immediately. And so it's not the drug of choice, but it is one little bonus that you can give them, if you have it available to you, is to give them 50 milligrams, 25 to 50 milligrams. Okay, sorry. Milligrams. I think children's Benadryl is 25 milligrams per teaspoon, so probably 2 teaspoons. So, but because it's dose varying, but usually when you buy Benadryl liquid, it's for kids. And so you would just need to look and say 25 milligrams, that would be 2 teaspoons. I'm pretty sure it's 2. Yes, they need to hold it in their mouth, and you would kind of even put it we call it the buccal membrane, between the cheek and the gum. Okay? I appreciate your attention. We're almost done. This is, I think, our second to last slide. So, with a burn, anybody here not ever been burned? Yeah, everybody knows the intensity of the pain of a burn and the heat of a burn. So what you want to do is you want to remove the heat source first. If it's a flame, stop, drop, and roll. Oxygen feeds fire. So you need to beat out the flames on them. If it's steam or contact, just remove them from the heat source. Remove the chemical, brush off dry chemical before you start to flood with water, because otherwise it'll just spread the chemical on them. If it's an electrical burn, you have to turn off the electricity before you can help them. Otherwise, you have 2 victims and nobody to help. So you can't just reach up and grab somebody that's that toaster thing. If we would have grabbed onto her, we would have received some of the electrical current as well. Cool the burn. You cool it with liquid available to you. Notice I didn't say water, I said liquid. If you have Kool-Aid, if you have juice, if you have milk, whatever, you want something cold. If you don't have access to cold water, say you're camping and you don't have the water or you're running out of water, then go to the cooler and get out the soda, get out whatever. It takes about 20 minutes to cool a burn, and you want to immerse a burn to cool it. So I would have a tub or a sink of running water, but you need to have running water. So I'd continually pour it over them, because if you just put it into warm water, you put something super hot into cool water, and it's going to become warm very quickly and not be effective. And then once the burn is adequately cooled, you apply aloe vera gel and cover it. And then for a 2nd and 3rd degree burn especially, because if it's 2nd and 3rd degree burn, the skin has been damaged. Now we have a high risk for bacteria to get in. So, and then seek medical care for burns. If a burn covers more than 9 or 10% of the body, it needs to be evaluated by a physician and cared for by a physician, unless it's a 1st degree burn. All right. Cool. Don't cool if they have greater than 20% of their body surface. They've lost their insulating layer. If they have a 2nd or 3rd degree burn, they no longer have the skin there, and that's what insulates our temperature, and so you can cause them to become profoundly hyperthermic if you cool their body with greater than 20% of a burn. Even though that sounds counterintuitive, it can be very harmful to them. So you would just simply cover them with a sheet. You can spray the sheet down with some water or get it damp, but you're not going to immerse them if they have greater than 20%. Don't neutralize chemicals. What happens when you mix vinegar and baking soda, an acid and a base? Exactly, and it can superheat. It can cause a flash heat as well. So don't neutralize the chemical if it's a chemical burn. Don't continue to move towards the victim if you start to feel electrical current coming up through your feet. That's when you need to stop, you need to turn around, you need to find the electrical source, turn it off before you go to help them. Don't apply ice on a burn. How many of you have done that before? Put ice on your burn, okay? It's another extreme temperature. Have you ever heard of frostbite? So you have tissue that's already damaged and you put another extreme temperature on it, and so it will further damage the tissue itself. So it's not the best practice. If it's the only thing you have to cool a burn, then use it. But that's the only reason that you should. Okay, and then don't use any home remedies, butter, shortening, grease, mustard. Those kinds of things actually have in them bacteria, and they're not sterile. And so it's not an effect, and they don't have any antibiotic in it, and so you can actually cause infection by putting those on. Okay, to estimate the body surface area of the burn, you should dance. Okay, are we going to dance the jig, the Virginia reel, square dance, the Macarena, or the hand jive, or true hillbilly, right? The polydactyly, which is more than 5 fingers on one hand. We have an option 6, which is both 4 and 5. Just take your best shot. She's got it. We got a true hillbilly in here. She's like, number 6, 6 fingers. But she had to use 2 hands, just so you know. So it's okay. Okay, the Macarena. When we estimate burn surfaces, the head is 9%. An arm is 9%, an arm is 9%, a chest is 9%, an abdomen is 9%, upper back, lower back, leg, 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 leg. Okay, so there's your 99, your genitalia is 1%. The rule of the hand is 1%. So if you look at somebody and they have a burn on them, you have to look at their palm size. So if it was a child, I would look at their palm size. My palm represents 1% of my body surface. So if I had scatter burns, I'd be like, okay, 1% here, 1% here, 1% here, 1% here, and I would add up my percentages. And that's how you'll know what percentage you should be at. Any questions on burn care? Thanks. Now go and be awesome. Woo! All right. I have for you, congratulations. You are all smarties, and you've learned how to be lifesavers. So I'd like you all to come get your packet. Thanks so much for coming today.